one of the things that we hear a lot is people having concerns about ketamine safety.
Mhm.
They hear stories about people going into K-holes. So can you talk to us a little bit about who ketamine is good for? If it goes wrong, how does it go wrong? Should people be a little nervous?
Mhm. So the only time that I would be concerned is if a person had a baseline psychotic disorder, like schizoaffective, schizophrenia, bipolar mania with psychotic features, bipolar depression with psychotic features. If that psychosis isn't under good control, a person could conceivably hallucinate during the treatment. And for us, out of 700 plus patients, that's happened 3 times, two of which the people were not aware of having had a psychotic issue before because they were recently diagnosed with depression, for instance. And the third was a medical issue that was completely unrelated. So 3 out of 700 plus patients, each of whom have received over 6 infusions, it's not a bad percentage. So it's really well tolerated. We've had 18-year-olds, we've had 84-year-olds, we've had little old ladies with gallon bags of medications with them. And so again, it's really well tolerated. The side effect profile is very minimal. About 30% of our folks experience mild headache or mild nausea, and about 1% of our folks experience a spike in their blood pressure. And again, you're more at risk if you already have uncontrolled hypertension, high blood pressure. But those are all things that we can treat in-house. And so it's generally really, really well tolerated. Going down the K-hole, there are a couple things that they're an issue with that. One is you're receiving a medication or drug that's off the street. You obviously don't know what the dosage is. You don't know what it's cut with. You don't know anything of what you're receiving. And the other thing is it's a matter of all at once. And so our infusions last between 45 minutes to an hour versus like in the emergency room where you get a bolus and you're injected and your brain is off in Mars somewhere and your body is still down here. You're not feeling anything, you're not seeing anything, you're not hearing anything, you don't remember anything. And so again, our objective isn't to get you high. Our objective isn't to use the medication at an anesthetic dose. Our objective is to just calm the nervous system down enough to where things can flow more easily and they can be more easily talked about. They can be more easily dealt with. Folks
Okay.
who are good for this particular treatment-resistant depression, anxiety, PTSD. Some OCD folks, we've had more of a 50-50 turnout for the OCD folks in terms of symptomatic reduction, but it's very hard to treat with any modality. And the only major contraindication outside of the hallucinations is if you're on big whopping doses of opioids or narcotics. Not that it's going to hurt you, but it's going to directly counteract the ketamine because the opioids, benzodiazepines, alcohol are all central nervous system depressants, and we're trying to do the opposite.
Okay. So do people need to get off their medications before
Not
ketamine?
necess not necessarily. We just warn them in advance that the ketamine could have a decreased efficacy and or we might have to bump the dose within that safe little window that we can operate safely on an outpatient basis.